Dr. Campbell, thanks for joining us today and sharing your experience with us. But if you could just take a minute to introduce yourself and talk about some of your experiences and thoughts around eConsults.
Okay, thank you. Well, I'm from South Africa. I've been working as a physician in Canada for about almost 25 years now. This is my 40th year in practice. I'm focused mainly on chronic pain now, although I've mostly done family physician work, occupational medicine, and disability medicine as well.
Can you tell us about your experience with eConsultations?
Right. At the beginning of 2019, I was offered a job doing chronic pain assessments, which is now my main focus. And that got me more involved in the virtual world. Remember, this is obviously pre-COVID. Now, for the last few months, I have been using Brightsquid. Although I live on Vancouver Island, it allows me to work travel-free in Alberta. The type of work I do on this platform is by far mostly chronic pain consults involving spinal pain. And I find that the ease of flow, the amount of detail available by merely checking the boxes, and this with a few text additions, makes it user-friendly and extremely easy to recommend. I think what I like best is that when I complete my chronic pain virtual consults, I feel like my work is not only well done, but done, period. With my other categories of work, there's often issues and little niggly points I have to follow up on, check on, and so forth. Things that occupy a lot of airtime in one's head, which one would rather cross off one's list. So I have the security that the work is well completed in a highly usable form, in my opinion, and that this helps my workflow as well as that of the referring physician. And we do have a sense that what is good for the treating physicians is probably also good for the patients, especially in this period of extended wait times. My opinion is that post-COVID, virtual medical care delivery is going to remain important. Obviously, platforms such as Brightsquid also give physicians more expansive work options. And when used on a larger scale, I suspect they may significantly help with physician burnout by providing ease of use, cutting down on unnecessary travel, as well as what I can perhaps best describe as less cumbersome communication. Having peace of mind and confidence that actionable medical direction is being provided efficiently, securely, and timelessly also obviously goes a long way in that direction. And I simply suggest that physicians try it out for virtual care.
Really appreciate your perspectives on this and, how this serves the greater community, really, because it's about connection of information, isn't it?
Absolutely. Yeah, no, it is. And, physician burnout now, which for the last 2 years has been almost 60%. And that is not during COVID times, right?
What do you see as the biggest benefit of eConsults to the realm of primary care?
There are quite a few, actually. The obvious benefits are efficiency and reach. The program reaching into the remote areas and patients being able to reach specialists, both for patients and physicians. Some patients we know are also too old or too frail at any particular time to travel when they could be safely seen virtually. Then there's the reality of Canadian winters and the vast distances. Also important now is that it is finally possible for the family physician to move forward with the patient by asking a question that can be dealt with by a specialist right away, rather than sending the patient the old way through the hospital acute care system and all that entails. That's causing a lot of physician anxiety. You've got somebody that you really need more direction to act on or to treat, and yet there's not a lot happening.
You mentioned that you believe eConsults done in this way that you're doing them are good for patient outcomes. Can you expand on that part as well?
Sure, I can give you my opinions. I do believe that completely. Wait times in Canada have been pretty extended for a long time now. Now, when we look at workflow, we tend to focus on ways of getting the work done. But then there's also this other important, less mentioned issue that is going on that involves patients living for extended periods in a state of anxiety, worry, perhaps with sleep dysregulation, all of which collectively are somewhat pathogenic. So it's not just about client satisfaction, but also client well-being. Although virtual care is a significant change from what we are used to, the patient would at least have the feeling, and rightly so, that they are being dealt with in good time and that things are happening and progressing.
Getting physicians answers for their patients is, just seems to be a bit of a load off physicians as well. You don't have that extra anxiety. It helps everybody move forward more quickly.
In my own level, I used to keep what's called a problem list, patients I needed to check on, and I kept it a hard copy, and they didn't go off the list until they were dealt with to my satisfaction. And the minute that list gets too long, life becomes, uncomfortable. So I get a lot of satisfaction knowing that things are being dealt with, or at least improved.
I know you're seeing really one side of it. You have insight into the other side in the family clinics. Can you just explain a little bit of the process of e-consultation and including a bit about what makes a complete request?
Well, my understanding of the referral process is that it's fairly straightforward. As to referral problems, from my own perspective, I do receive a few that have really too little information, a very small number, and I mean minuscule. I've had to decline based on inadequate information. Then there's also the over-inclusive referral package. This makes it difficult for the specialist to review in a reasonable time. What sometimes happens is one delegates the task to someone frontline who's maybe less trained, and to be safe, they spend more. I don't feel comfortable till I actually read every document. So I can see the date, but is there something in there?
And so in that sense, I mean, we've kind of talked around this a little bit, but do you see eConsults as detrimental or supportive of traditional practice?
No, I see it as actually very supportive, especially in the context I mentioned, but in general as well, because I believe that if we were to remove or curtail the service that we have now, post the COVID session, I could say, or period, there would be patient resistance, at least to a degree. What we usually see is we all have this normalcy bias to stick with what we already know and with what is the proven way. And I think that's also safe in many aspects. But I've sometimes wondered to myself whether in the early days of the telephone existence, some physicians initially might have felt it inappropriate, or even it might have been very uncomfortable for them conducting any of their professional work by phone. That having been said, there's no substitute for the physical examination when necessary or appropriate. And this is very important, and I have to say it, as diagnosis can certainly be made virtually, but it's sometimes way more of a challenge, or often I would say way more of a challenge, to specifically rule out important, serious differential diagnoses, as we well know.
So it's an important point. I think you'd be hard-pressed to find anybody advocating for an end to a physical presence in healthcare and medicine. But it's also just as important to point out that, certain conditions, certain diagnoses can be made this way, and to be aware of the limits of each and make sure that your process goes appropriately.
As a clinician, I mean, the judgment saves the day. If there's that feeling that I know if I were in a position where I felt something tells me I should see this patient, I just have that feel, that's probably the leak of multiple experiences over years telling you, let's just be sure on this one.
And then, so one final question, how do you see the use of eConsult supporting the sustainability of healthcare in Alberta?
I think it's particularly good for Alberta, as I mentioned before, with a harsh climate, land mass, aging population, and there is the benefit of cost reduction it offers in the current, I would say, strained global financial situation. And it's conceivable that costs could be reduced by office sharing between a greater number of physicians, with the virtual care part done from, I guess, anywhere. So instead of having 5 physicians sharing a suite of rooms, you could have 10, but then being devoted elsewhere to virtual work. So from my perspective, the question is not so much about the choice between what we have now or reverting to what was. For me, it's more of a question of whether we will be able to implement and grow it in a reliable and durable way. Now, personally, I'm quite optimistic about it.